La vida es corta sin parar, mirar y de reír para celebrar. Cada momento hay que gozar, como si mañana no va a llegar.
Hola, hola. Welcome to Entre Tías Amiguis, the podcast where we dive into the wild roller coaster ride of adulting. I'm your host, Audrey Rodriguez, a queer Salvadorian native, a first-gen trailblazer, a multipreneur and licensed psychotherapist, here to share wisdom, stories, and real talk with my tías and amiguis and other incredible guests who inspire and uplift our community. I want to remind you that while I am a licensed psychotherapist, this podcast is for informational and entertainment purposes only. The discussions we have here are not substitute for professional mental health advice, diagnosis, or treatment. Now let's dive into today's conversation and explore the journey of adulting together. Grab your cafecito, get comfy, and let's get started. Welcome to Entre Tías Amiguis, another podcast episode where we talk about the wild roller coaster ride of adulting. And I have a very special guest today who's going to talk to us about one of the wilder parts of adulting. Yes. Everything like motherhood and all the things. I was just sharing off camera how much I've learned from you every time we interact. And so I'm really excited to be able to have open this conversation, because I think this is going to have to be like a multiple part intentional for me to like meet different lenses. But usually what I start is like when I introduce myself, I always talk about how I'm an immigrant. I also was the eldest daughter in an immigrant family. I grew up in a very fundamentalist religion. Yeah. I'm a first gen. So all these lenses, right, they inform who I am as a podcaster, who I am as a therapist, who I am as a person in the world, navigating all this like hats, right, that I have to wear. And inevitably, right, there is this like, I can't be a blank screen, just like, oh yeah, there's nothing that influences how I think. And so I always have like want to recognize that part, that our experiences really shape the lens of the work that we do. And as therapists, that our work also gets influenced by those experiences. So as you introduce yourself, why don't you also share with us some of the identities, background, experiences that you've had that also inform the lens of the work that you do. And so here is my dear friend, Lauren.
Hi, everybody. First of all, I just want to say thank you so much for having me in this space. I'm really looking forward to it. So my name is Lauren. My last name is Pulis. My husband had to teach me how to say it. It's like a church pew and a little girl named Liz, and then you smash them together. Yeah. I get a whole breath. Yeah, I didn't know how to say her last name. So I was like, is it, the first time I met him, I was like, Police? It's like, oh, he's like, no, Pulis. Like, you just have to like Americanize it and like the most American way possible. I was like, okay, great. So my name is Lauren Pulis. I am a licensed marriage and family therapist, and I have a private practice called Millennial Mama Therapy, where I focus on maternal mental health. I work with mamas individually, and I also work with parent couples, because often that's something that we don't realize is going to be such a huge shift when we move into parenthood, is how our relationship with our partner changes, adding the co-parenting relationship in on top of that. And then you were talking about some of the identities and things that I bring to the table or that influence who I am. So I am a cishet white woman. I am the oldest daughter in my family. I'm the second child, the oldest daughter. So I have an older brother, and then I have 3 younger brothers. So that is a family of 5 kids, which was a lot of fun and a lot of craziness growing up. Let me see. I have lived in Sacramento for 12 years now, and that is the longest that I have ever lived in a single place in my entire life. I grew up moving all over the place. I also grew up in a fundamentalist religion. My parents are missionaries. My dad is a pastor. And so from the time that I was 7 until I was 15, 16, we lived in Poland. And so I went to school there in the Polish public school system until about 8th grade. Then I switched to homeschooling for the rest of high school to just kind of get me on the academic track for coming back to the States and going to college. When I was in high school, we made a really big transition and moved from Poland to Hong Kong. So we were in Hong Kong for about 3 years. And then from Hong Kong, I came back to the States for college. And in that kind of crazy process was in school in the Midwest for a little bit, then in Southern California. Around my sophomore year, my parents relocated, and family, my brothers relocated from Hong Kong to the Sacramento area. And after I graduated from college, I relocated up here, and I had met my husband my senior year of college, and lo and behold, he was also from Sacramento. So we moved up here, got jobs, started grad school, got married, and now, however many years later, I think this year was our 8th anniversary. I feel bad that I'm trying to remember now. But we have 2 kids now. So I became a mom. That's another big identity piece for me. I became a mom in 2021 to my older daughter, Harper. She's 3.5. And then at the time of recording, my second daughter, Nora, is about to turn 1 on the 19th. So in like 8 days.
In 8 days.
Yeah. Yep. So in that process, I always say that I was a therapist before I became a mom. And a lot of the reasons that I wanted to become a therapist had to do with things that I experienced growing up, just sometimes feeling like I didn't have somebody to talk to about the different things that I was going through, adolescence, all of the moving, family stuff, learning about who I was. When I originally became went to school to become a therapist, I thought that I wanted to work with fellow missionary kids, or another term is third culture kids. It basically is this like umbrella term that captures anybody who in their formative years was raised in a culture that was not their home culture. So honestly, you would be a third culture kid as well, because your personal culture, Audrey's personal culture, is a blend of, the United States and then your culture of origin.
I never knew that about that term, third culture kids.
Yeah, TCK, isn't it cool? So
That's pretty neat.
Yeah, so that was like a big identity piece for me for a long time, was like this, third culture kid aspect where like I look like an American, I talk like an American, I maybe sound like an American. But if you ask me about pop culture in the United States between like the years of like 2002 and like 2008, I'm drawing a blank. Like the amount of things, like the times that my husband is like, oh my God, remember this? And I was like, no.
That is same thing as the 90s. Yes. My wife all the time is referencing the 90s, and I'm like, I'm an immigrant. I was not here.
I was not here.
I watched the Thundercats in Spanish. I watched like the movies Dennis the Menace in Spanish, right? Like I don't know anything in English of those formative years.
Exactly. No, before we were recording, you had said something. You were like, oh, okay, but I don't know what the word for this is in English, but it's kind of this idea. And I was like, I have had that so many times where I'm like, I can tell you what the word for that is in Polish. I have no clue what the word for that is in English. Like, or like I have this thing where I see somebody with a Polish last name and I am so lost, like an American with a Polish last name, and I can clock them from like a mile away, but I have no idea how to say their last name. Because I know how to pronounce it in Polish. I have no idea how you would Americanize it. It's kind of like the Pulis, like, how do you say this? I don't know.
That's fascinating.
So that's a really big piece that like I kind of bring to the table. And like I said, I originally thought that I wanted to work with TCKs. That's why I got into the space of working in mental health, was I wanted to work with people who are like me. But like I was saying, I was a therapist before I became a mom. I was not a therapist who specialized in maternal mental health until I became a mom. And I can remember like still being in the hospital, like with my first, after a very healthy, uncomplicated pregnancy, a slightly complicated birth, but overall, like as a cishet white woman, married white woman with a very supportive family, with health insurance, with a really wonderful OB who, like, even though he was a white man, was still very, very like wonderful and affirming and supportive to me as a patient and things like that. All of these factors going on, these different layers of my identity and privilege, and going, oh my God, this is so effing hard. And I had no idea. And I just remember thinking, like, if me as a mental health professional is struggling so much with my mental health, and again, all of these other layers that we talk about of like protective factors or levels of privilege, how much harder is this for other, birthing people?
As you start adding layers of identity.
Exactly. And like the lack of education for pregnant people. Like, it feels like we get so much education during the pregnancy, or maybe even during the fertility process, up until the point that the baby exits a body. And then afterwards it's like, well,
I mean, that's the joke of like parents always say kids don't come with a manual, right?
No,
and it's like,
they don't. And it's also absolutely crazy to me. Like, I was just like, oh, I could just like have a baby. Like, my husband,
you're just gonna trust me.
You just trust me. Like, you just let me go home. Like, my husband and I joke that we had to go through so much more like vetting to adopt our dog than to bring home our child from the hospital. Like, I was like, do you know if do you know that I have like things at home? Like, I do, but like, you're not going to come and like vet, like make sure that like, I don't know, like all the like outlets are covered.
Yeah.
I don't know what I'm doing. Like, feeding a baby is really, really hard. And they just like send you home. I'm like, I don't know what I'm doing. How do I know when they're hungry? Like, how do I know if they're actually like, as I'm attempting to like breastfeed, how do I know that they're like getting what they need?
Yeah, like how do you get to know all of this? Like they assume that you just know and you will figure it out, I guess.
Exactly. Like
they, I guess we, non-parent people or medical providers.
Right, exactly. Well, and even like as a pregnant person, you're like, oh, I'll figure it out. It's very, very interesting, the piece where like, as one of my good friends, Kelly, she's a Matrescence educator. And so she has a course called Navigating New Motherhood, where she looks at motherhood and parenthood from a biological, sociological, anthropological, like evolutionary lens, and looking at how that has shifted like over like, you know, the like, I guess, like existence of humanity, and shifting from it being done in this like social way to now it's so individualistic. Like the first time that a lot of us like witness a birth is like maybe seeing a YouTube video during like our birthing class, or actually giving birth ourselves, versus you think about in the past where it was like, yeah, you probably would have seen your mother give birth when you were still like an adolescent. You maybe would have seen your mother like breastfeed or things like that.
Even participated in the community care.
Exactly. Yes.
Bringing the baby.
Exactly.
And, like, change of like the mother. And so like more communal.
Exactly. It's like that shift was a lot more visible, versus now it is visible, but there's like a polishedness to it of like what we see on social media, or even if you see like, you know, you're in line to get coffee and there's a mom with a new baby in there and you're like, oh my God, your baby is so precious. How old? And she's like, oh, 3 weeks. Oh my God, 3 weeks. Well, it looks like you're doing good. Like you assume she's doing good because she's standing in line at Starbucks, but you don't see the immense struggle that she has been through. Like she is standing there clothed. Like you have no idea that 3 hours before she was standing like in her like adult diaper in the middle of her room.
Because you probably are still wearing the diaper.
Oh, you are. Oh my gosh, even longer. Like, I mean, months.
The things that we are not thinking about in terms of this change.
No, exactly. Yeah, there's so many elements of this change.
Yeah,
that happens. So.
Well, that has been like one of the big parts of just being in community with you. Like you introduced like the term matrescence.
Yes.
You like talked about like the way the placenta like detaches from the body. Like I know a lot more stuff than I did 6 months ago ever since like meeting Lauren. And so, but before going into more like the educational part, because there is a lot we're going to leave with this episode, there is a part around, you were talking about your idea of being a therapist was one thing. And then once you had this life change, then was it like an interest, a necessity? Like how did that go from being a third culture kid focus into like motherhood focus.
Yeah, exactly. Well, so the third culture kid focus, that kind of began to start to fall away a little bit as I began to have identity shifts just in the course of being a human. Growing up, because I had moved so much, lived cross-culturally, was trying to figure out how do I like make sense of like my place in the world as this unique blend of like an American and a Polish person, like, and I also lived in Hong Kong for several years. And so in that process, I was exposed to a variety of like different cultures, because Hong Kong is a very, very diverse place. Like, honestly, I felt so at home in Hong Kong because all of my friends were like multi-passport holders. Like everybody there was like in Hong Kong for a season, but they were not necessarily from Hong Kong, born and raised. Some people were, but a lot of people were Australian or from the UK or American or from the Philippines or what have you. So as I came back to the States and as I kind of began to be like, okay, like I am in the States now more and beginning to learn more about who I was as a person, as I shifted, through the end of adolescence and into being an adult and thinking about career in the future, finishing out college and stuff like that, I really began to like, not step away from that identity, but I was having so much angst with that identity piece and feeling like I don't know who I am apart from being a third culture kid, that in a way I kind of had to, for my own purposes, almost intentionally set that aside, where it was like, okay, that was a season of my life where that was like the forefront of my identity. But now I'm in a space where I am in the States and that is not my entire identity. And so I can't just be looking for like community and relationships and purpose in life through only that lens. And so that, like, it was interesting. Like, it's so funny that we're talking about this because I haven't thought about this in so long. But, you know, as I was like dating my husband and we were getting ready to get married and all these things, like really trying to like learn from him, from his perspectives, because he's from Sacramento, born and raised. So like his parents still live in the same house they brought him home from the hospital to, like all the things. And so it was kind of like, okay, like how do I start kind of seeing the world through some of his lenses, like growing comfortable with that. It was kind of like in the same way that when we moved to Poland, it was uncomfortable, like rooting into that culture there and getting to know it. I had to kind of do a similar process here where I'm like, this is where I am. And so I need to kind of root in here and start building like a sense of connection and peace with the community that I'm in now. And so part of that was like releasing, okay, maybe I don't necessarily want to work just with TCKs. And as I moved through the process of finishing out my graduate degree and then starting to work with clients and getting my hours and stuff, really in that process, I kind of was like, who do I want to work with? I don't know. Like you just like are given anyone and everything that to work with. And it really wasn't until I became a mom, which was when I was an associate, that things really clicked for me. I had started liking to work with couples a lot because I found that dynamic really, really interesting. And I really liked working with women. But I don't know, I feel like there's a thing like as a woman, it's like, no, you shouldn't just work with like female patients and stuff like that. But I really enjoy working with like women. And like I had taken a really great gender communication class in college. And that was like the first time that like my eyes were really, really opened up to things like misogyny and like systemic issues that face women and things like that. So I was like, no, I really enjoy working with women. And then when I became a mom, I was like, okay, here we go. This feels like an area that is like underserved, like an area that I feel passionate about, that I can bring aspects of who I am as a person to my work as a therapist. And also like if I, as a privileged person, can bring my voice to be raising awareness for all moms and birthing people, particularly those who are marginalized and things like that. Like, then that's something that I want to do. So, and it's funny because it almost began like immediately because I had really bad baby blues with my first daughter.
So like immediately you were not only going through the transition of a mom, but also utilizing some of your own knowledge to like try to understand what was going on with you.
Yes, exactly. Like I remember sitting there going like, is this baby blues? Is it postpartum depression? I mean, even as a therapist and as a mom, I had no idea what the difference was, which I will say this is like one of the big things that I like clarify for people. Baby blues is very much tied with the hormones of giving birth and your pregnancy coming to an end. So you're talking about the placenta detaching and delivering and things like that. When the placenta detaches, that starts triggering this whole hormone cascade in your body that tells your body the baby is no longer here, so we can start making milk. We can start moving into some of these other hormone processes and things to help you bond and support with your baby. So baby blues is really associated with that huge hormone cascade because it is the like biggest hormone shift in the most rapid amount of time that a human will ever experience in their entire biological like lifespan. Like
so your body is changing from this very specific function to like a whole different function.
Yes, exactly. My friend Kelly that I referenced, she has this great chart that shows you are on this like hormone roller coaster your entire pregnancy. So over 9 months, your hormone levels are increasing. I think it might be progesterone or estrogen. I don't know. I'm going to mess it up. Nobody quote me on this. But what I do know is that suddenly, like if down here is where your like monthly cycle is, like, you know, as somebody who has a female reproductive system, you are on this huge roller coaster up here, and then all of a sudden it just drops. It's like going through menopause. Like,
and that's just the baby blues.
Yes. That's what happens like within 48 hours after you give birth. So baby blues is like that is baby blues in a way. Like what kind of help like triggers baby blues. So baby blues only occur in the first 2 weeks after you give birth to your child. So if you are experiencing low mood, irritability, anxiety, depression
beyond
those 2 weeks, now we're looking at something more clinical. So baby blues occurs. It's a universal experience. Like we see it in every single culture, in every single country, in every single ethnic group across the world. It is a universal experience.
Because it's more of a biological driven experience.
Yeah, because it's a very biological driven experience. So it's universal. And then something that I find very helpful to also point out is that there are not really any protective factors for it because, again, it's a biological thing, very biologically rooted. But like money and socioeconomic status are not protective. Neither are, race or ethnic group or things like that. Like those things are not protective the way that we sometimes see like across certain, cultural breakdowns and things like that. It's like, oh, we see this more common over here versus over here and, things like that.
So despite where you come from, the intersections of your identity, you likely will experience a degree of baby blues. Some people may experience something like very strong, and they may have a two-parent household, and they may have food train that people are bringing in. So those things, they're not protective factors because they don't make it not happen. Yeah. But you may have a little bit of an easier time.
Exactly. It's not protective factors, but there can be supportive factors where like maybe you notice it less because you have somebody who is coming in to care for your, like maybe you can afford a nighttime doula. Maybe you have the meal train and things like that. Maybe you have this or that or the other, and maybe you don't. So it's yes, that's a really good way of putting it. There's nothing that can necessarily prevent it from happening because it's a very biologically based, but there are things that you can do to support yourself afterwards.
And even the knowledge, I mean, like as a non-parent or person that does not plan to birth, but knowing a lot of people, even the knowledge of just like, hey, like this 2 weeks maybe will likely be extra hard. Yes. And because later on I want to talk about the village, right? And like the recognition of just like I'm part of many villages and I don't know how to be in the village. So this was like a point that I'm like kind of chewing in of just like, okay, a friend who births will have this very hormonal moment in their up to 2 weeks. And they likely could use a little bit of extra support.
Yeah, exactly. Exactly. Some other like kind of hallmarks are of the baby blues, lots of crying, lots of tearfulness. I remember crying to my husband being like, I'm so sick of crying. And I'm crying again. Why am I crying? I'm happy, but sometimes you will feel sad. Some things that are, again, hallmarks of it is overall, the mom's sense of self-esteem does not really change in the sense of, there will be moments of like not feeling like yourself. You are in this huge identity shift, which is matrescence. And so when you hear matrescence, think like adolescence, how that is a huge identity shift that happens. Like it's a multi-year span. Same thing with like matrescence. I honestly think that once you get on the matrescence train, you never really get off of it. And I'm not sure if there's such a thing as like patrescence or parent essence. Maybe I'm making that up, but like just that identity shift of being a parent, now having a tiny human who is reliant on you for every single aspect of like their care and keeping.
That's a good question to like think about, because also all of this is very understudied. Even as therapists, like how hard it is to find a maternal health or parental health
because we're having to self-educate about it, like self-specialize into it, because it's not, I don't know about you, but I never got any education about maternal mental health as a graduate student. There's actually been bills being pushed forward. I
teach sexuality and gender, so I teach, but it's like a 2-hour moment, it's like a moment is not sufficient to cover all the aspects.
This continues to go back to that piece of like misogyny, and then like me, and even just like the history of like obstetric care, OBGYN care, and how a lot of that is rooted in racism.
I mean, the clitoris wasn't mapped until 2005. Like, what else is going to give like this like very misogynistic sort of lens of medical care, like the interest of like figuring out what's going on there. And that's not to diminish that there is good work, that there are providers, that there is research, but it's not in a way that is accessible even for therapists in training. Right?
Exactly. It's that thing of like, there is good work happening. It needs to continue. Let's keep talking about this. Like, let's keep like motivation going. It's so interesting. We were, one of the things that I talk about often with my clients, with my mom clients, is that piece of like the common experience of anger postpartum, where it's like, I didn't know it was going to be like this. Nobody told me, nobody warned me. Also, this is crazy. Like, I had this experience, and I know several other moms, either in my personal life or that I've worked with professionally, who have said something similar, where they're like, why is it that I have been pregnant for 9 months, seeing my doctor every single week? Like at the very end, like you go, like it's like at first it's once a month, then it's every other week, and then it's weekly at the very end of your pregnancy. I give birth, I go through this intense labor, delivery, birth experience, however you give birth, whether it is vaginal, whether it is through C-section. And then I am sent home from the hospital with this new baby. And within 3 or 4 days of the baby being born, the baby has a doctor's appointment. And then another week after that, they have another one. And then usually another week after that they have another one. But mom, you do not get, unless you have like major complications of some sort. I think I remember them telling me, unless you're passing clots the size of a golf ball. Like when you're passing clots the size of a golf ball, give us a call and we'll get you in. But otherwise, you're not seen until 6 weeks postpartum.
So this aftercare that happens is baby focus. It's not
it's
mother focus or parent
focus.
It's
this really, really jarring experience where the focus has been on you, or it feels like it's been on you this entire pregnancy, because any care for the baby is through you because the baby is in your body. But then as soon as the baby is born, the care shifts really onto the baby. Like, I remember, like, the way that I explained it to my husband was, like, and this is in the throes of my baby blues and crying and stuff like that, where I was like, I just feel like I'm so forgotten and I'm not seen. It felt like Harper and I were in a car accident and I was ejected from the vehicle and, like, laying in a ditch bleeding somewhere. She was totally safe and fine because I had, like, buckled her into her car seat. She was nice and safe. But EMS comes, they find her, they get her, and they're like, do a cursory, like, oh, we can't find anybody. Oh, well, look, it's more important. We got to get this baby to the hospital, load her up in the back of the ambulance, and like, like go away. And I'm left laying in a ditch is how it felt in a lot of ways. And so I think that's the piece that sometimes is really hard as moms, is we have been getting this care and then we don't realize, like, you know, it's like that care has been offered up. Do you think you need another appointment? And then postpartum, it's like you have to advocate for it. You have to ask for it. You need to be planning for your care. Like you have to fight to get in sooner than that 6-week appointment. You have to be passing a clot the size of a golf ball, which, believe me, there have been moments where there were moments where I was like, I'm just going to tell him that because I need to get in. And I know moms who have, where they're like, I just will say whatever they need me to say so I can get in because I just feel like I need to be seen.
Wow.
Yeah.
That's heartbreaking.
It is. It really is. And again, but then you're like also met with those like cultural messages of like, your baby is so beautiful. What a beautiful experience. You're doing so great. You should be so happy. And you're sitting there like bleeding, leaking milk, sweating like crazy because of your hormones and things like that. You just have all the bodily fluids going on. Your baby has maybe spit up on you or pooped on you or peed on you and things like that, going like, I'm supposed to be happy right now. Like I wanted this. Like the amount of moms and parents who get to the other side and go, did I make a mistake? Should I have done this? Like if you ever felt that way, that is very, very normal. And you are not a bad mom and you are not a bad parent for feeling that way. That is a very, very normal experience because we are not educated about what this like earth-shattering experience is like. It's like you are pregnant for 9 months and then you become a parent in a second. Like that baby exits your body and is put on your chest. Like however they exit your body. Again, I like always like to clarify that no matter how you give birth, like you gave birth and that is amazing. So like, yeah, it's such a jarring transition that many of us, including those of us like myself who are like, I had a master's degree at the time in mental health. I was married. I had health insurance. I trusted my OB. I had a great relationship with my husband and with my parents and with my in-laws. Like at the time, you know, my whole family lived within like 20 minutes of us. Like I had really, really good friendships and I still was struggling so much.
That must be such a disorienting experience, right? Yeah. Disorienting. Like I couldn't, because the mixed messages, the expectations, But I guess even for the ones in the outside, right? Because even other birthing parents, your own mom, your own grandma, your aunties, whoever gave birth before you, may themselves have romanticized experience. Because something that I hear is that you all forget that this happened to you because you do it again.
I'm glad that you brought that up, because that's honestly a huge reason why I chose to specialize into maternal mental health, is because of the aspect that sometimes we'll turn to those like veteran moms in our community, like to our moms and our aunties and our grandmas and things like that, and just not get the care or validation that we thought. And it's one of those really challenging, like both and situations where like having to hold your experience as true and valid and having to hold their experience as true and valid, because we do forget. Oxytocin, a huge amount of oxytocin is released at the time of birth. And oxytocin is like a love bonding hormone. Oxytocin also does like cause us to forget the pain of childbirth, the pain of how painful that pregnancy was. Like, you know, there's also the aspect of rosy retrospect. When we look back, we tend to remember things as better than we felt they were in the moment. And that is very, very, very true. Like there is like, it's hard to look at like a brand new squishy little baby and like not go, oh my God, you are so precious and beautiful and wonderful. Like, no, you're not going to be thinking about the fact that when you gave birth 30 years ago, there was XYZ that happened, how hard this was. And I think there's also this piece of like wanting to support new moms and new parents and be a positive support for them. But sometimes it falls into that like toxic positivity where it's like, sometimes what parents need is like the both and, the yes and. Yes, this is hard and you are a wonderful parent. You are a wonderful parent and this is really hard. You can struggle and feel like you made a mistake and love your baby more than anything on planet Earth.
And that's why the word disorienting comes to my mind, because there is like a multitude of contradictions.
Yes.
And they both are true. You can be having this like very serious baby blues and still be like, I'm so glad I had this baby. Like I'm sure like and that's to be confusing. And it's then for the recipient, right? For like the guests that come and see you, right?
Yes.
It's just like, oh, hold your baby. It's like, how are you doing? Oh, we're doing good. Right? And he's like, she said she's fine. They said they're fine. So I'm going to believe them. And me as a non-birthing parent, I have no clue. But even people that have birthed, they forgot the struggle of it. So what is a new parent to do as they're going through this whole entire change and they look seemingly fine? And society also romanticizes it.
Oh, 100%. They're like
maternity,
so
right?
Oh my gosh. Absolutely. It is so romanticized. And it's like, I think those of us who talk about like how hard it is, like feel the weight and like the duty of like, it is hard and it is beautiful. And in talking about how hard it is, we don't want to take away from the beauty of it and what a meaningful experience it is. But it's kind of that thing of just like wanting to like do the experience justice. Like, can we talk about the fullness of it? Can we like educate first-time parents about that? It's going to be hard and it's going to be beautiful. It's like whenever I have like pregnant mamas come in and work with me, especially like first-time mamas, I love it so much because I get to talk with them about, okay, we are preparing you to be unprepared. Like, I don't have a crystal ball. I can't read the future. I have no idea how the rest of your pregnancy is going to go, how your birth experience is going to go, how your feeding journey with your baby, however you choose to feed your baby, which again, however you choose to feed your baby is valid. Or whatever your situation requires of you in terms of feeding your baby is valid. I have no idea what that's going to look like. So we are just preparing you to be unprepared. I do a lot of DBT, dialectical behavioral therapy skills, like distress tolerance of going, we don't know what you are going to be facing.
You will be distressed and we need you to tolerate it so that then you can care for yourself.
Yes, exactly. Exactly. So, and it's a lot of like, trying to teach skills ahead of time of like, okay, when somebody asks, how can they help you? take them up on it and start doing a thing where it's like, okay, we have a chore chart that we just keep on the fridge in the kitchen. So that way, whenever somebody comes over, the expectation is before you hold the baby, you got to pick something off the chore chart and do that.
I love that
like,
so much.
That way, then it's like, it's taking taking this mental weight and mental load off the parents to like come up in the moment with like, Sally Joe is visiting me and she asked what I can do. Could she feed my baby? No, she can't breastfeed my baby. I don't know what she could do right now.
Yeah.
So things like that, it's like trying to almost put systems into place ahead of time to be supportive of the mom, both like systems in terms of like cultural and societal systems, as well as like practical things of like, hey, we always, every time we think of something we need from the store, every time we think of something that we need to do, we write it on this thing. And then when visitors come, they automatically know. We try to communicate ahead of time what our boundaries are and always reserve the right to adapt and change our boundaries as needed once we know what the situation requires. Because, maybe, you've had a very medically healthy and uncomplicated pregnancy, and then there are complications during birth or delivery, and now you are in a situation where mom and baby are more medically fragile. Well, yeah.
You need a lot more than
you're going to need a lot more care, and that also may be like, hey, we wanted everybody to come over right away, but actually, no, we can't because baby is really susceptible right now. Or maybe it doesn't feel safe to mom because mom's anxiety is really, really high. And so we're working on getting that addressed. It just really is like preparing them to be unprepared. It's like, we can't know what the specifics are that are going to come up for them, but how do we give them tools and skill sets to adapt and adjust and tolerate whatever distress happens to come up.
Where my mind goes then is the shame, like how shame also must play a role here, because there is also the expectation that you should be able to figure it out, right? And then maybe the village doesn't know how to help, and so it's like, but they're saying they're fine, so it's like I'm gonna believe them, and they're not fine, but they're ashamed to saying they're fine because everybody's expecting them to be fine. Like, it's what a complicated
it is, and it's like a self-perpetuating like cycle. So
because we've been talking about the parenting, like the matrescence part of them, like the ongoing matrescence. We're literally focused on like the first.
We're talking about like the first, like they sometimes call it the fourth trimester. So like the first 3 months postpartum, like the first 12 weeks of your baby's life. This is an interesting factoid for you. Honestly, babies, when they are born at 40 weeks, they really, really should be considered premature in some ways, because ideally, like, have you ever like seen in the animal world, like an elephant is born and then like the baby immediately hops up and is like walking around, and then like human babies are born and it's like,
a little blob.
They're like a little blob, and it's like, oh my God, you even need help breathing. Like, what is going on here? Like, you can't do anything. The growth and development between like a newborn and a 3-month-old, it's crazy. Like the amount of development that they have, like regulating body temperature, like being able to like burp or fart or pass gas. Like, you have to help them with that when they are brand new, because they still have body systems that are coming online that aren't fully developed. The only reason that babies are born at 40 weeks is because the human body cannot sustain a pregnancy for longer than that. Like,
but they could be in there a little bit longer.
They could really use being in there for a little bit longer. And that's part of why it's so intense for moms early on, because your baby cannot do anything. Like, they cannot regulate body temperature. They cannot regulate like their heartbeat sometimes, like having the skin to skin, like their hormones. They are so much of like what's happening for them is like based on you. Like, in a way, like it's kind of like you are still pregnant in terms of the amount of like your baby just needing to be with you, on you.
They're
like
just
at
on
all
the
times.
outside.
They're
This
just on the
is
outside.
So fascinating and equally scary and equally like, wow. Why? Like, how are people doing this all the time? Thank you for your service, because it just sounds like a lot.
It is. And well, and isn't it crazy though? Because it's like when you look at different cultures around the world, like China has a like 100-day celebration for when the baby is 100 days old. And during that 100-day period beforehand, there are very strict rules for mom in terms of getting rest, what she should eat, eating foods that are nourishing for her body. They also do something where they like bind mom's abdomen. And it's not at all like a beauty thing necessarily. It's very supportive of mom's core, because after being pregnant for 9 months, like there's a massive abdominal separation that happens. Your core is a lot weaker. And so like there's a lot of focus on caring for mom, caring for baby. Like mom's only job is to like rest and be with her baby. And there's a lot of other people like moms and aunties who come in and care for mom. And we see this in a variety of cultures around the world.
In Latin America, we have cuarentena, which is 40 days. Yes. It's like for 40 days. And I remember as a little kid growing up in a different country, right? Yeah. That it's very different here, right?
Yeah,
that there is this like, you know, expectation that within like a week, you're like out and about doing your things and kind of
get up and going, caring for your baby, going back to work. Like the amount of moms that have to go back to work at like 6 weeks or less postpartum,
which is not even the full next third trimester.
No, it's not even the full fourth trimester. And honestly, on top of that, it takes a full 12 to 18 months for your body to recover from pregnancy, childbirth, all the hormones. I mean, we were even just talking about this like beforehand, but like my younger daughter is about to turn 1. We are in the process of weaning off of breastfeeding and things like that. So I am still very much in that like season of like brand new baby, like haven't totally feeling like I'm recovered from having a baby yet. You know, I did not feel totally back to normal with my first until I was about 18 months old. Like I can distinctly remember I had a lot of like pelvis and hip issues with my first pregnancy. And I remember telling my husband, like after I had her, that it felt like for the longest time, if I took a corner too fast, like when I was walking or something, like my pelvis was going to crack in half. Like it felt like half my body was going one way and half was going the other. Because things just didn't feel like they were solidified back together.
Well, like the body has gone through so much.
It has. And there's also a hormone called relaxin that is released during your pregnancy that does exactly what the name says. It relaxes like your muscles, your joints, your ligaments and things like that. So that way your body can expand to make room as baby grows, but then also so that way your pelvis can expand and separate to make room for baby to exit your body. And then it takes a while for the relaxin to leave your body. So after having your baby, a lot of times, like we do see a lot of injuries in moms like back or hip or neck or sprained ankles and things like that, because our bodies are just a little bit more like loosely jointed, a little bit more jello-like.
Wow.
You know?
And so you're telling me all of this, but there's no follow-up aftercare for the parent, for the mom, when they go to the doctor. And it's like, how stretchy are you? I don't know. What the doctor should be following up? It sounds like a lot. How is like your pelvis feeling? Right. How is your abdominal walls recovering? Like all of this stuff.
Pelvic floor PT is life-changing for the postpartum person. It is so, so important. Like, you know, the jokes and stuff about like, oh yeah, like I pee a little when I sneeze. That's pelvic floor weakness. You shouldn't be experiencing that. You can address that. Like a lot of times, birthing people will report like pain during intercourse, like during penetrative sex and things like that. You shouldn't feel that way. Like there are things to, and if you do feel that way, no shame, but just to educate, like pelvic floor PT is incredibly helpful for that. But do we get referrals for that? No. Also, a lot of times, as you and I can like often attest in the mental health field, the best providers, the most informed providers, the most inclusive providers, the ones who are really going to listen to you and hear your situation are outside of the medical system, or do not take insurance. So,
because insurance is going to be doing the minimum required medical necessity, right? And that's exactly that's a whole nother conversation in terms of insurance. But I can see here how if what is medically necessary, right, has a limit, and what you need is additional, and all the intersections of all the things that are getting in the way. You got to go to work, or even not knowing that.
And that's a huge thing, because a lot of people don't know. I had no idea. I'd never heard of pelvic floor PT, like,
or knowing that you can have a better quality of life. That you're not going to be peeing every time that you
like jumping on the trampoline or sneezing, right? Or, all of that.
Or that your intercourse is going to be your penetrative intercourse is going to be painful. I guess maybe there could be even an assumption that these things are just normal. But you're saying is, if if people had more access to the additional support, they would quickly find out of some of these things that are being normalized or expected.
Yes.
And this goes back to misogyny, honestly, because it is the expectation that like women should not be like experiencing this pain, or that
women should be having babies.
Should be having babies,
like,
and therefore should be easy.
The things that I say, I'm like, becoming a mother has made me so staunchly supportive of people who are intentionally by choice child free. I'm a firm believer that you should not have a baby, should not have children unless that is something that you are choosing for yourself. Because one of the things that was very supportive for me during the hardships of postpartum was going, I chose this. I wanted this. I had autonomy and choice in this. Like, yes, I didn't know it was going to be this hard. And like my feelings that this is hard are valid. And I find soothing and comfort in the fact that I chose this. Like, this is a aspect of like my life as a human, my life as a woman, my life as a mother that I wanted to explore and dive into. But if it's not something that you chose, or it's something that you feel pressured into, or you are feeling like guilt and shame for the fact that you are intentionally child-free, that's not okay. That is absolutely not okay. We all should have the ability to choose to live the life that is most in alignment with our core values and our needs. Like, you know, so like I said, the two things that I became very staunchly supportive of are people who are child-free. I love people who are child-free, because just because someone is choosing to be child-free does not mean that they don't like children. It means that they love children and they have a desire to pour into children, to have that capacity to pour into like their nibblings, to pour into their friends' children, to pour into children that are in their life in another capacity. And that is so beautiful. And as a parent, so necessary. Oh my God. Like, I love the safe, healthy relationships that my daughters have with other adults in our lives, whether it's aunties and uncles, whether it's chosen family. Like, as a parent, I can't parent them and raise them on my own. I need that support. And it is so beautiful. And a lot of the people that I do have in my life are child free. And so they have extra capacity. They get to go home and recharge. So they've got the extra energy to just run around the zoo with my child, where I'm like, okay, I'm going to sit back and just like sit on a bench here and have silence for a minute at the zoo.
My sister just sent me this meme that was like, this is what is being an auntie. I'm tired. Here's a baby back.
Exactly. And then there's moments where it's like, okay, I got to have a rest. Thank you. I'll take my baby back. Like, you know, there's things that you can do for my child that like are amazing. And then there's things that only I can do for my child. Thank you for doing the things that you can do for my child. I will take them back to do things that only I can do, you know? And then the other thing that I was going to say is I also became very, very pro-choice, very, very staunchly pro-choice after, having my kiddos. And the main reason for that is, again, just autonomy, people having the ability to choose what is right for them. Also, on top of the fact that it's like, it's medical care. And I don't think that like a lot of people realized this, but like the medical treatment for women who are going through a miscarriage, who are going through a neonatal death. So that's when like, you know, the baby dies in utero past 20 weeks of pregnancy. And those are often wanted babies, loved babies, wanted pregnancies. The treatment for those, when there's a situation where like, okay, the pregnancy cannot continue, the pregnancy has ended, is an abortion, is like the DNC. And so what's happening is, with the lack of access, is we have women who are being put into really unsafe medical situations, like sepsis and infection, because of the fact that they're not able to get the medical care that they need to address this medical issue, because of the fact that doctors are worried about being arrested and sued and things like that. So
as an example of that rhetoric around an abortion at 38 weeks, the language being used, though, is correct. The potential of that case being in utero death that is medical necessity to have a DNC is very different. How the rhetoric is being used, that people are using abortions as birth control or to not have this baby. Like, in fact, these are very difficult medical
These are very difficult.
decisions.
Right, exactly. Very difficult decisions. Typically, I would have to I want to make sure that I'm using proper language and things like that, because I'm sure there's going to be people out there who are saying that maybe I'm not using the correct language. So I'm always open to being corrected and things like that. Because typically if there's like a late term loss, like at 38 weeks or something like that, say the baby has passed in utero, then they will try to like induce labor so that mom can like give birth. So I don't know if that's like a DNC.
Gotcha.
Earlier on it is, but there are situations where it's incredibly sad, like termination for medical reasons, where you know, where there is a decision to end a pregnancy, sometimes late term, because it's taken that long to find the space to do that, because the baby has such a life-threatening, incompatible with life diagnosis that they will lead a life of pain. And as a parent going, what do I want for my child? I don't want them to be in pain. Like they might even be in pain right now in utero and things like that. There's
a complicated journey.
It's a very,
an emotional journey.
very, very, very complicated. So the thing that I always try to like encourage people in is how can we bring more grace and compassion and understanding, and recognizing that these are it's a very, very nuanced experience. Everybody's experience in motherhood and parenthood is so unique and individual. So there's no way, going back to kind of what I was saying earlier, there's no way that we can prepare for absolutely every eventuality. But how do we prepare you to be unprepared? How do we, to the best of our ability, build in skill sets for like distress tolerance, for
anxiety, for the unknown, for flexibility.
Yeah, exactly. How do we, the other thing that I really love doing is educating people about all of the different tools in their toolbox that they could use. So for example, medication. There's a psychotropic medication gets a really bad rap, especially during pregnancy and postpartum, but sometimes medication is the only life-saving
necessary.
Thing. It is absolutely necessary. And so I always point back to PSI, Postpartum Support International. They're on the forefront of doing research, education, and advocacy for perinatal mental health and postpartum mental health. And what I love is they have a prescriber hotline. So if you have a prescriber who is uncertain about prescribing medication to somebody who is pregnant and or postpartum or breastfeeding, or wants to talk to somebody and get some more information about what are appropriate medications or dosages or and whatnot, your prescriber can call that hotline for free and get that consultation. Because a lot of times, unfortunately, we'll see really uninformed providers say, okay, well, you need to get off of your medication. And it's particularly in situations where, say, like you have a pregnant person who has a diagnosis of bipolar and they are medicated. It's absolutely dangerous for them to get off of their medication while they are pregnant. They need to stay on their medication. Maybe there needs to be an adjustment, but that is absolutely something that needs to be addressed with a prescriber who is educated about these kinds of things.
Because I hear in here, like, so the next part of my question is kind of like two-part. It's like, what can we do as providers, right, to support folks going through this period of perinatal, postnatal, matrescence? What does the village need to know, right, to support? Because I feel myself unprepared. Like I'm prepared to offer compassion. I'm prepared to understand. I'm prepared to work in building distress tolerance. But there is a way that this also requires like a very specific knowledge, training, and also debunking of myths.
100%.
There was this data that I shared with my students recently around like how therapists, but with no bad intention, we have this research show that therapists, we are reinforcing gender roles and gender narratives to people on accident, right? Particularly towards women, around like pain tolerance, around, there was the study talked about protecting men from shame, right? And so all these parts will show up around the experience of parenting, maternity, birthing. And many of us as therapists, we are unprepared, and not only unprepared, but run the risk that our internalized ideals of what this period should look like. Right? I would be mortified if somebody came to therapy and said that they're having a really hard time, and then a therapist said, but isn't it great that you have your baby? Like that would be so harmful. But I could see not only therapists, but other providers, right? And like I don't know how to help you. I don't have enough information. So I'm just going to throw in something positive, or the village doing the same thing, right? It was just like, I'm going to my village, to my bestie, to my cousin, to my sister, to my mom, and because of lack of information or because their experience being so different than yours, being invalidating or just throwing in like a positive spin and then leaving the mother, this parent that just went through this like traumatic body, physical experience, feeling even more isolated or alone or confused as to what they should be feeling or what this experience should be like. So what are some of the recommendations from both like the village perspective, right? What can we do better? And also as providers, what are some of the things that we should be doing, particularly mental health providers?
Absolutely. So mental health providers, I think that absolutely self-seeking some education around maternal mental health. Like I said, PSI, Postpartum Support International.
And we'll put that on the show notes.
Yeah, we absolutely will. I will send you all the information. Are amazing. They've got a lot of different blogs and resources and things like that for providers. They have trainings. Their first training is called, I think it's called Components of Care for PMADS. PMADS stands for Perinatal Mood and Anxiety Disorders. So that's kind of like the term, the umbrella term that has replaced like postpartum depression or something like that. But PMADS like kind of encompasses all of it, the anxiety, depression, psychosis, things like that. So seeking out some education for yourself, just at a basic level, because unfortunately I heard a story recently about a mama who had her baby and then had a provider that she had been working with for a long time. And then after she had her baby, went back and was seeing her provider, her mental health therapist, and was just kind of talking about some things that were going on. And the therapist was like, I can support you, but honestly, this isn't really something that I specialize in. So I think I'm going to need to send you somewhere else. Here's a link to Psychology Today, and like basically terminated treatment with her. I know.
Oh my gosh. For those of you not watching the video, I'm like frozen at this because it is not a unbelievable story. These things happen.
It's not. And it's one of those things where I'm like, I was so glad that, the person was able to go on and get the care that they needed and things like that with a provider who was informed about perinatal mental health. But it's like, it doesn't, sometimes I feel like there's a fear amongst providers where it's like, oh, I don't know what to do with that. And it's like, they're just a person. They're just a person, and there are some other factors that we need to be aware of that are unique to this phase of life, but it's just a client the same as anybody else. Yeah. Start with just listening and validating and saying you are okay. Yeah. Like, you are okay as you are. It's okay to not feel okay. Yeah. Like, you are valid. What you are going through is normal. Like, I'm not going to leave you. Yeah. Like, honestly, just knowing PSI is amazing. Like, go there for resources. They have a provider directory where, if as a provider, you have somebody sitting in front of you where you're going, hey, I'm curious if I may no longer be the right therapist for you. But instead of dropping you right now, let's keep meeting. I don't want to lose track of you and what's going on with you.
We have a responsibility to create that bridge.
Exactly. Let me help bridge care. How would you as a client feel about that? Knowing that, because I will often do that with, somebody maybe comes in and I'm like, hey, I just want you to know that maybe I don't specialize or have much experience in XYZ. I absolutely can work with XYZ that you are bringing in, but maybe not this thing over here. How do you feel about us, working together, like just bringing the client in and letting them have autonomy and choice in that is such a huge thing. So that's kind of the provider thing that I would say is like seek out some education, find a perinatal therapist near you that you like. I promise, like, honestly, the perinatal community, like, providers are so wonderful across the board of like the different types of specialties that are in that space, because so often we are in it because of something we've been through. And so it's like we are trying to be the provider that we needed when we were in that space. So we love educating others and having conversations and providing resources. So PSI is where it starts for that. And then when it comes to the village, the people who are in that mama's or birthing parents' life, I think asking them specific questions, like I've seen those, like on the internet, those little text threads going around where it's like, good morning. I just want you to know that I am coming over today and I'm just going to be at your house today. I can do blah, 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 blah. Like, feel free to say no to this. You have the option to say no, but I am going to come over today and you are going to choose your own adventure. I can hold the baby while you shower, or if it's helpful and you want to hold your baby, then I am going to do 3 household tasks for you. So when I arrive, give me a list of what you need to do. Then I am going to go to the grocery store and blah, 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 and get the things for you. I'm also bringing over a freezer meal for you. Like, sometimes it is so hard in that moment to ask for help. Like, there's the joke and like kind of pejorative term of mom brain, but really what is happening is there's a huge amount of neural pruning, again, the hormones that happens after we have a baby, where our brain is like talking like a normal human being, like chop that out, like trigonometry, chop that out, because our brain is kind of getting rid of the fluff so that way it can focus on learning the baby, learning what does this cry mean, learning when to, like what the baby needs, like what are the specific things going on. And oftentimes there's a lot of troubleshooting and problem solving. When you first receive your baby, you might have some troubleshooting that you have to go through because they're brand new. A lot of their systems aren't online yet. Like my youngest daughter, Nora, she had really bad oral ties. She was a happy, happy baby the first 3 weeks of her life. And then I did remember there was one night where she just did not sleep and screamed her head off the entire night. And like, my mental health just like tanked. I was like, what is going on? It was so hard. And here come to find out that what was happening was she was able to eat and get food at the breast, but because she had these oral ties going on, it created a lot of tightness and tension in her mouth. So she wasn't able to create a seal when she was eating. And so when she was eating, she was taking in a lot of air, and then she was not being able to get the air out of her tummy. So she was having really bad gas pain, really bad tummy pain. So it took us 3 or 4 nights to kind of figure out what on earth was going on. She was fine during the day because during the day we were holding her and she was upright. At night, it was anytime we tried to lay her down. Like, I mean, it was crazy. And so then we had to go through the whole process of getting the oral ties released and all those assessments and like, bills. It gets really, really expensive. Like after having a child, like it sometimes just feels like you're hemorrhaging money. Cause again, all of the oral tie releases was specialty type care. Like our insurance would have covered, the procedure is called a frenectomy, and they would have covered the frenectomy if it had been done in a doctor's office or a surgical center because it's considered a surgery. But because we did it at a pediatric dentist, at a dentist who is oral tie informed and who specialized in that procedure, we had to pay for that procedure out of pocket.
It's dental care, not health care, I guess.
Exactly. Lactation support, all those different sorts of things. So like coming back to what I was saying, sometimes as a parent, you have all of this going on. And so it's like, I don't know what needs to be done in my house. Like, can you just look around and pick something, anything? I'm just appreciative of anything. Or like as a support person, maybe it's knowing, hey, mom has this list on the fridge. And when you notice something, like as you are vacuuming, noticing, okay, like I think this floor really could use a mopping. I can't get to the mopping because I do have things on my plate that I have to get to. We get it. We understand you guys have a life outside of us, but writing mop the kitchen on the floor. So that way the next person who comes knows, okay, mopping the floor would be really, really helpful, or this or that. So it's a lot of like noticing. And I think that there's an aspect too, where gently speaking to your birthing person and going, I know you are saying that you are fine. And I'm glad that you are fine. I still want to give you help. And I know it's hard for you to receive help. A lot of what I have like read or heard or research says that parents need help. So I would like to offer you my help. Will you accept it? Like, it's kind of like calling them out on their bullshit a little bit, because we want to seem like we're fine. We want to have it all together. That's what Instagram shows. So even just compassionately being able to dismantle that to that person, and maybe even like ahead of time, like if you have somebody in your life who is expecting a baby, being able to say, hey, like, here's this podcast episode, like send it to them, like how can I support you ahead of time? I'll also send you in the, to put in the show notes, but PSI has like a course or like a planning for new parenthood course kind of a thing of like putting together like help for your village. The other thing, I lead a workshop every couple of months with two of my colleagues, Kelly and Brittany. Brittany is a California parental leave specialist, so helping you navigate all things parental leave. And then Kelly, I referenced earlier, is a Matrescence educator. But we talk about planning for new parenthood. How do you maximize your maternal leave or family leave? How do you, and then Kelly talks about matrescence, like that early like transition into motherhood from like the biology, sociological, anthropological evolutionary perspective. And then I talk about maternal mental health. And a lot of what we talk about is putting plans in place to help prepare you and things like that. So,
yeah.
if you have a loved one in your life who is planning to have a baby or is currently pregnant or has new babies, like just doing things like that to like educate yourself and resource yourself to just know about things. There's a lot of really wonderful like Instagram accounts of perinatal educators that you can follow. You guys can go to like my followers on Instagram or the people that I follow and then like go through and just like find them out because there's so many wonderful things. So just like normalizing, sending us a funny meme is also very helpful, like in the middle of the night of like, okay, saw this, thought this would be funny and maybe make you laugh. So
thank you so much, Lauren. Like, I feel like every time I talk to you, like so much that I learned. And so my hope with this conversation is that folks who both are in any spectrum of parenting or not parenting, but that will have people around who might choose to have a baby and like, how can we become support, but also to like normalize some of these experiences.
Exactly.
If you do choose to go through the parenting journey, right? Because your life is going to change a whole lot. And it is beautiful. And it also sounds like really hard, and so we want to make space for both.
It is. I can't remember where I heard this term, but it's a brutiful. Like it's beautiful. It's beautiful and it is brutal. Like the both and. And I just want to say to like any new parents out there, like any like loved ones of new parents and stuff like that. Please don't feel any shame that you don't know some of this.
Yeah.
Like we were saying earlier, like society, like. Our society has shifted from like birth, parenting, and things like that being very like prominent in kind of like the center of our life to it being very like hidden away and not seen. So like I said, I didn't know about a lot of this until I became a mom, until like I gave birth and this baby was handed to me and I was like, oh dear God. Yeah. Oh my word. So
and not even, the whole different conversation, but like the breaking of collectivism to individualism, right?
Yes.
That a lot of this process has become a nuclear family issue need versus like a community. And so I think it is important to think about the community, how we are showing up for the community that we love too. And like when I was hearing you talk, I felt like emotional because it's like I could have used this information as a non-parent like a few years ago to support some of the people that I love, but I honestly didn't know how. You don't. And I also believed them that they were fine, right? And then I'm like, oh man, maybe like it's not guilt or shame, but it's just like how useful it is to know so that I can offer something else that also I can continue to educate myself for my clients. And so this conversation was so beautiful, and I was gonna say we should have a second episode, but honestly you should have your own podcast because this is just not a one-time conversation. So
maybe I have thought about it. I'm not at the point to get it launched yet, but I think that would be an amazing
content that you're putting out because it is so educational. And I think that that's what I've appreciated about being in community with you. It's like the way that you're breaking down the information feels so digestible and hard, but it's also easy to like.
Yeah. It's like, it's one of those things, it's like when you start thinking about it, it's like, oh, it makes sense. And the last thing that I want is for anyone to feel shame about this because we're not taught. We were not told. We are not taught. It's like we don't know what we don't know. Like it's in our blind spot. And so then there's a piece of like, as something comes into our awareness, then what do we do with it? And not getting paralyzed in that shame of like, oh my gosh, and I don't know. For me, sometimes like I find it very healing to just like tackle something like head on and be like, oh, wow, like I really did not know that. I am so sorry that I didn't know that. I remember talking to my best friend. She had her first baby about 18 months before I had mine. And I remember telling her, I tried my best to be supportive during her pregnancy and all of this, but she kind of had this like almost 2-year period where like I just wasn't a mom yet. And the amount of times after I had my older daughter that I went back to her and said, I am so sorry for what I said before I became a parent. I had no idea. I had no clue. Oh my gosh, I am so sorry. And the amount of times that she was just like, yeah, it's fine. It's totally fine. You don't know what you don't know. You don't know what you don't know.
I feel like I'm going to send this episode to my mom friends and be like, sorry it's late, but like, let's reestablish some where are you? Because,
where are you?
Because this matrescence also, it's like a period. So it doesn't end, right?
It doesn't end. It doesn't end. Like that first year is so much like just keeping the kid alive. And then after that, like I remember when like Harper turned 18 months old, it was like, oh shit, I have to figure out how to parent you. Oh my God. And then now it's like she's 3.5. And I feel like my husband and I are absolutely like top notch hostage negotiators now. Like, please don't call us in if you need us. I don't think we're actually that good at it, but it's like, okay, we got to like negotiate. We got to do this, like having to like, it shifts from like just caring for base, like physical needs to caring for these like mental and emotional needs and things like that. And like things that are so rational to your child that you're like, oh my God. Why is this such a big deal? I don't. So I am still consider myself like a novice baby parent. I haven't even hit the
your baby's only just about to be one.
Yeah,
so
exactly. So like the matrescence journey, like you are like once you get on that ride, you are just on it as you hit empty nesters, as you have adult children, as your children become parents, and now you are a grandparent. Those are all like different pieces of that identity to explore and to shift into.
Yeah.
So.
Oh my gosh, so much more to keep talking about. And so I'm thankful for your time, for your expertise.
Thank you.
I will put all the ways to be in touch with you, but the easiest millennial mama therapy.
Yep, millennial mama therapy.
That is like such a catchy, easy way to connect, but all the show notes will have the details about how to stay in touch with you. Yeah. And also for therapists for consultation, because we do have a duty to be educated on this. And we have people like you that can walk us through some of this, either point us to the right direction or provide us with some information. And we have a responsibility to parents, to mothers, to support them through this journey. So
absolutely.
Thank you so much.
Thank you so much, Audrey. This was so much fun.
All right. Until next time, entre tías y amigas.
Bye.
Bye. If you enjoyed this episode, please subscribe, leave a review, and share with your tías and amiguis. Your support helps us reach more people and continue these important conversations. And don't forget to follow us on social media and stay connected. Until next time, remember to take care of yourself, embrace your journey, and keep living life with heart, vision, and creativity.